By the end of yesterday, China's mainland reported that now there are 4,735 confirmed cases, including 1,573 severe cases. In accumulative terms, 73,159 cases are cured and discharged from hospitals, 3,277 fatal cases, 81,171 confirmed cases, and the remaining suspected cases, 132. In total, close contacts traced 691,185, and the close contacts still under medical observation, 12,077. For Hubei, the new confirmed case, 1 in Wuhan. There is no suspect case and no remaining suspect case. New cured and discharged from hospital cases, 444, including 426 in Wuhan. New fatal cases, 7, all in Wuhan. The remaining confirmed cases, 4,318, including 4,268 in Wuhan. Among these cases, there are 1,539 severe cases, including 1,527 in Wuhan. In accumulative terms, there are 60,323 cases cured and discharged from hospitals, including 43,214 in Wuhan. Fatal cases, 3,160, including 2,524 in Wuhan. Confirmed cases, 67,801, including 50,006 in Wuhan. Yesterday, between 0 and 24 o'clock, for new imported cases, 74. Among them, 31 in Beijing, 14 in Guangdong, 9 in Shanghai, 5 in Fujian, 4 in Tianjin, 3 in Jiangsu, 2 in Zhejiang, 2 in Sichuan, and 1 in Shanxi, Liaoning, Shandong, and Chongqing, respectively. By the end of yesterday, in accumulative terms, altogether, there are 427 imported cases reported, and there are 576 cases confirmed and reported from Hong Kong, Macau, and Taiwan, including 356 from Hong Kong SAR, 25 from Macau SAR, and 195 from the Taiwan region. Yesterday, the new confirmed cases, 78, in Beijing, Shanghai, Hubei, Guangdong. The domestic cases, 1 respectively, and there are 74 imported cases. According to the latest updates from WHO, the global confirmed cases have exceeded 300,000. The sporadic cases and the imported case-caused spreading risk are quite severe, and we should always keep alert. So that's all for the update of the pandemic. Now we will have the Q&A. Please focus on today's topic and put forward your questions. Please identify yourself. Now the floor is open. Please, on the left, on the front row, the second reporter, please. Thank you. With Xinmin Evening News, in the previous press conference, you mentioned that COVID-19 is a viral disease, and what are the common features of such diseases compared with other viral infections like SARS or hand-foot-mouth disease? What are the unique features of COVID-19? We will have Dr. Wang Guiqiang to answer the question. Okay, thank you for your question. For viral diseases, they are sharing similar features, and the COVID-19 is one of such viral diseases. Virus is the smallest microbe, and it should survive on or within a cell and infect other cells. In general, we can see that for COVID-19 or for other major viral diseases, there are no specific cures, and we only have a few specific medicines to address the virus, like influenza. However, such medicines are just supportive and can only shorten the duration of the infection. But of course, there are some viral diseases like hepatitis B, and also for HIV/AIDS, we can only control the progression. But hepatitis C is an exception. Now we have the cure. So hepatitis C is the only viral disease that can be cured by a particular drug. In terms of COVID-19, the features of this particular disease compared with other viral diseases can be identified as follows. First, it is quite contagious. It is much more contagious than SARS, and compared with influenza, we can see similar contagious feature. And in terms of the symptoms developed, we can find that it is causing severe symptoms, more severe symptoms than influenza, but less severe symptom than SARS. And in terms of the viral duration, we can see it is quite long. The viral shedding time is quite long. Compared with SARS and influenza, it is longer in terms of the viral shedding. It's a new viral disease, and there are many unknowns about this disease, so we need to continue our study and observation. It is hoped that with scientific studies, we can gradually gain knowledge about the virus and the disease, like the serological dynamics and also the conversions. Okay, thank you. Let's continue. On the right, on the front row, the first lady reporter, close to the aisle, please. With CCTV. My question is about overseas importation. On March the 11th, WHO described the pandemic as the pandemic, and now we are faced with a mounting risk of overseas importation. So what about the future trend? And for the hub cities and the border cities, are they faced with increasing pressure? And also, will the overseas importation leading to another wave of pandemic spread?
I'd like to ask Professor Wu Zunyu to answer the question. Thank you for your question. The global pandemic is still spreading. As our moderator has reported, the updates on the cases changes. Statistics has shown that there has been an increase of imported cases in cities as ports of entries and transportation hubs. They are faced with greater pressure of prevention of imported cases. There has been great outcome in domestic control, and there has been an increasing pressure of imported risks. Will there be a second wave of transmission because of imported cases? This is a question of public concern. We've set up 3 lines of defense which can prevent imported cases. First, the inbound travelers, infected travelers, the customs serve as the first line of defense by temperature monitoring, symptom inquiry, and health declaration cards which contains information of travel history. The symptomatic infected travelers can be screened, and they are directly transferred to designated hospitals for treatment. The second line of defense is the 14 days quarantine for inbound travelers. For those asymptomatic virus carriers whose virus is still in incubation period, they can be identified during the 14-day quarantine, and once symptoms are onset, they can be transferred to designated hospitals for treatment. And the third line of defense is for the missings from the first line and the second line of defenses. And these may go to the health institutions for treatment, but with the previous efforts, our health staff can know what to do with these imported patients. With this needed network, most of the cases can be stopped at the first line and the second line of defenses. And up till now, our third line of defense hasn't been initiated for use. So we believe these lines of defense can prevent the second wave of transmission triggered by imported cases. Next question, please. Thank you. With the Hong Kong-China review, there has been gradual discharging of patients. What has been the effectiveness of TCM in the cure of these patients? I'd like to ask Dr. Wang Rongbin to take the question. This is a commonly concerned question. TCM has a merit of facilitating rehabilitation. The previous experiences have shown that 70,000 plus patients have been discharged from hospitals, but they may have certain symptoms like fatigue and shortness of breath, insomnia, and depression, poor digestion. So for effects like this, TCM is very much needed, because TCM focuses on the entire cycle of treatment and has accumulated thousands of years of experiences. There are many consensus-based prescriptions which are used not only in TCM hospitals, but also very much recommended by the comprehensive hospitals with proven effects. In the 7th edition of Diagnosis and Treatment Protocol, there has been full recognition of these effects. The dialect treatment with TCM medicines are needed by a minority of patients. I believe most of the rehabilitation needs TCM-featured intervention technologies for transition to health, because most of these symptoms are function-related. So TCM can use as a very good modulator. TCM experts have already introduced effective ways of changing diets. There are many diets that just by looking and imagining, you will have a better appetite. And there are also the 5 functions of music, which are related to the 5 internal organs, which can alleviate the pressure of the patients. Also acupuncture, moxibustion, the massage along the meridians, respiratory poems for the exercising of respiratory functions, the Tai Chi or shadow boxing, and the Baduanjing, some traditional Chinese exercises. There are also some exercises that have been compiled, dedicated for the rehabilitation of COVID-19 patients, which can help patients to resume their vital energy. There are also some rehabilitation TCM stations in Wuhan. In other places where there are not so many discharged patients, they can use the TCM outpatient departments for treatment. Most of the TCM are related to TCM medicines or the meridian massage, so better consult a professional TCM doctor. There are also some patients with organ these functions, like the inflammation, has been absorbed only slowly in the lung functions. Therefore, TCM medicine is recommended for the further absorption of the exudates from inflammation. There are also some severe patients who suffered from dysfunction and failure or fibrosis of the lungs. If there is the consolidation of the lung, this may be with the patient throughout the life course. We should learn from our lessons and experiences of sequelae effects from our combat against SARS. Therefore, we encourage patients to use TCM rehabilitation exercises to limit the damages on the lung fibrosis. Using TCM to deal with lung fibrosis is a complicated issue. It involves persistent efforts made by patients and doctors. Dialytic treatment can be the starter with consensus-based prescriptions. But later, there should also be the use of the formulas. We can use some widely proven formulas which came into being through research projects. These medicines can be used to sustain the lung functions of the patients, but the TCM treatment take effect with the patients and the persistence of both patients and doctors. The detoxifying and the clearing of stagnation, the removing of heat accumulation have been proven effective for these syndromes. Next question, please.
Thank you. I'm China Rep TV journalist. China already has a big experience in medical treatment. Will China recommend the treatment of Chinese medicine to the rest of the world? Thank you.
好，请翻译一下问题。
谢谢，来自中阿卫视的记者。目前，中国已经取得了很多抗击新冠肺炎疫情的经验，其中也包括中医方面的经验。中国是否会向世界推荐采用中医的治疗方法？
好，我们继续请王荣斌老师来回答这个问题。
I'd like to ask Dr. Wang Rongbin to provide an answer. Yesterday, the Party Secretary General, Madam Yu Yanhong from the State Administration of Traditional Chinese Medicine, has told the public that we had experiences from the previous efforts, and we are very willing to stand in solidarity with the rest of the world and contribute China's experiences in TCM.
谢谢。
Thank you. Thank you. Let's continue. On the left, on the fifth row, the lady reporter, please. Thank you. With Shenzhen Satellite TV. It is found that epidemiological surveys have been conducted, and there are ongoing epidemiological surveys. So what are the latest findings? We will have Professor Wu Zunyu to answer the question. Thank you for your question. For epidemiological survey, it is an acronym for epidemiological survey. In Chinese, we call it 流调, and it is of critical importance for the studies of the diseases, in particular the epidemics. For epidemiological surveys, once an infectious disease is reported, we will have public health professionals to look into the disease. An important topic is how the patient gets infected and who has passed the infection to him, and also prior to his symptoms development, has he contacted anyone, and is it possible that he passes on the virus to other people. This is of critical importance to to epidemic control. So it requires very careful studies, and also it is depending on the mutual trust and patience of the epidemiologists. So being an epidemiological survey staff, you have to be very patient and communicate or discuss with the patient, asking him to remember in detail whoever he has contacted. So these people are what we call the close contacts. For close contacts, it is requested that they should be quarantined for 14 days. The duration of the quarantine period is determined by the COVID-19 disease. It is expected that the symptoms onset should be within 14 days of contact. Otherwise, we can say that this particular close contact has not been affected. So we need to identify such a transmission chain of the virus. At the moment, the focus of the epidemiological studies is that in Hubei, it remains to be the close monitoring and the follow-up visits of the people who are discharged from hospitals. We have to acknowledge that our knowledge of this disease or this virus is very limited because it only emerged last December. So we need to conduct follow-up studies. And another focus is that we should guard against the potential importation of the pandemic. Based on our screenings at the entry points like airports, we will have the quarantine period for the inbound travelers, and such quarantine period lasts 14 days. And also, we are going to have the epidemiological study on these inbound travelers and the quarantined travelers to see if there's a secondary transmission. On February the 2nd, when I went to Wuhan, there were more than 1,000 epidemiological study teams, and each team is composed of at least 5 people. They are of critical importance to the epidemic containment. Okay, let's continue. On the right, on the 4th row, the lady reporter, please. Thank you. With Business News Daily, how about the postmortem studies and what are the major findings? We will have Dr. Wang Huiqiang to answer your question. Thank you. It's a very technical question. Up to now, there have been a few teams who are engaged in the post-mortem studies or the autopsy. At the moment, 29 autopsy studies have been conducted, and in the 7th diagnosis and treatment guideline, the findings have been integrated. Of course, the larger the sample size, the better the knowledge we gain. Indeed, for this particular disease, we find that the virus has attacked the lung. In the lungs of the deceased, we find many traces of the viral attack. Also, we find the emblem and the tissues which had been attacked by the virus. So it is of very severe symptom. And also we find some secretions, and these secretions have blocked the pulmonary system, directly affecting the oxygen level within the human body. Furthermore, we have the electronic electrical scope studies, and also with the nucleic acid test, we find the antigens and the various demonstrations of the viral attack. So these are important clinical indicators, and that's why we have adopted clinical practices like the nebulation, as we have gained knowledge from such pathological studies. And also we have applied the antiviral treatment based on the information and knowledge we have gained from the autopsies. Furthermore, we find that the immune system is gravely attacked by the virus. As you know, the immune system is a critical barrier against the viral attack. However, among the deceased cases, we found that the immune system is gravely affected. At the moment, we are not clear why the immune system was attacked, but the demonstrations are very clear and obvious. For the lymphocyte, for the internal organs, we can see that the immune system was severely attacked, including the bone marrow. In the bone marrow, there should be a lot of cells which are immune, which should play the role of immune system, but their number has been greatly reduced. So this is also consistent with the clinical findings, and we learn the knowledge that the virus has attacked the immune system. That's why in the current treatment guideline, we have applied the suggestion to boost the immune system by using certain drugs to control the replication of the virus. And of course, in the future, we need to follow very closely the potential nosocomial infection, because as the patients are severely attacked, their immune system is severely attacked, then it is quite likely, or it is they are very easily subject to the nosocomial infection, which may lead to the severe consequences. And of course, other systems like the heart, the liver, and other organs have been attacked too. But are they the primary infections? We are not clear about the answer, because the oxygen level in these organs is limited due to the virus attack, and at the moment we don't know which has caused which.
So the focus was on the prevention of organ failure. Pathological changes have given us important clinical hints to adopt measures in preventing the fatality rate. We hope that with the autopsy study, we can have a whole picture to work out much better, even better clinical pathways. Thank you. Next question, please. Thank you. With Taiwan Communication News, WHO has defined asymptomatic patients as unconfirmed cases. So what is the logic of this categorization? For asymptomatic patients, will they pass on the virus to others? I'd like to ask Professor Wu Zunyu to answer the question. Thank you for putting forward this very important question. It is also of our common concern as to what is the definition and classification of asymptomatic patient. We use the current laboratory testing to test a positive virus of COVID-19 in these patients with laboratory testing methods, but they do not show any symptom. We define people as such as asymptomatic patients. How do we find them? We observe among the close contacts And we conduct sampling and laboratory testing on the observed close contacts. And then we find PCR results are positive, so they are infected with the virus, but they do not show any symptom. With continuous observation, then some of these people show symptoms. And these patients were then transferred to designated hospitals, and they change, their classification change from asymptomatic people to confirmed patients. There were also those, even until the end of our observation period, they do not show any symptom. With or without symptom among these asymptomatic infected, they are identified in observed close contacts, and they are under management. Another part of the question is on the possibility of passing on or transmission. No, because in China, all the close contacts are in quarantine, and they are in separate rooms. Once there is the symptom onset, they will be transferred to hospitals. It won't lead to transmission. We should be highly alert against the risk of transmission from asymptomatic patients. So in our precautionary measures, we pay special attention to guard against transmission from these group of people. Again, thank you for your question. Next question, please. Thank you. China Media Group with CNR. Unit Diagnostic and Treatment Protocol, the individual or personalized treatment, there are oxygenated support. What are the measures, effects of oxygenated treatment? Are they effective? I'd like to ask Professor Wang to answer the question. Thank you. There has been differentiated treatment on COVID-19 patients. This is an important experience for us. In the early stages, there were an enormous amount of patients in Wuhan, mild, moderate, and severe or critical patients. We did the triage based on unique features. That was an important challenge for the Wuhan response. And up till now, we've accumulated great experiences for mild cases. We had collective pooling, quarantine, the monitoring over the vital signs, and if there is any escalation, they will be transferred. For the severe and the critical patients, they were in designated hospitals because their prognosis is a high fatality rate and the progression was very fast. So this triage was very important. Now we see in other countries, like in Italy, there was a sudden surge of patients' number. It is never emphasized enough of the triage. Otherwise, the mild patients are taking up important hospital beds and leading to a high fatality because the severe or critical patients could not be saved. So that was both our experience and lesson. And the second part of your question is on our treatment methods. We have comprehensive treatment, oxygenated treatment included. It may not be necessary for the mild patients, but even for moderate patients, since pneumonia has developed, it is important to have oxygenated treatment. For severe patients, oxygenated treatment includes other types, invasive ventilators, and non-invasive ventilators, or even ECMO. So we have different levels or tiers of respiratory functional support. For some of the patients, if the situation is not severe, oxygenated treatment, pure and simple, will be enough. But sometimes we need to clear the sputum, and we need to use intubation. as a greater intervention of oxygenated treatment. Oxygen is needed by multiple organs. If oxygen is not provided effectively and in a timely manner, it may lead to multi-organ failure or even fatality. Therefore, oxygenated treatment is needed for moderate, severe, and critical patients. But still, it is differentiated among different levels of severity. Some patients have underlying diseases like heart diseases, hypertension, liver diseases, and hypoxia may lead to easy damages on the organs. So it is essential for us to support the organs with oxygen. With different tiered and differentiated oxygenated treatment, great outcome have already been shown. Fatality rate has seen a substantial decrease. Oxygenated treatment has provided a very effective role. Next question, please. With China Daily. In the media reports, we hear ECMO very often. We know it is an important equipment for the treatment of severe patients. What is their specific role? Thank you. I'd like to again ask Dr. Wang Guiqiang to take the question. Yes, it is a very professional question. ECMO, extracorporeal oxygenation, is an artificial lung. It's like an artificial lung provided. It's like an extracorporeal liver that may provide an extracorporeal liver function. ECMO is playing the roles of lung and heart because it can provide oxygen. After the lung has been damaged, we may find there has been the hyaline membrane formation in the lung, where the lungs may fail the exchanges with oxygen. But with ECMO, it forms the membrane, and it can facilitate the lung oxygen exchanges. ECMO system is also an effective protection on the lung functions. It can help the lung to rest, to restore, and to regenerate. The sputum that has been formed can be removed. The exudation that have been formed can also be removed by using the ECMO. In the 7th edition of Diagnosis and Treatment Protocol, it is explicitly pointed out that non-invasive or invasive in ventilation, if fails to reach the effects, ECMO will be immediately used to protect the lung and heart and prevent important organs from failures. ECMO's usage has been effective in reducing fatality rate.
Thank you. Let's continue. On the left, on the second row, the third lady reporter, please. Thank you. With the cover, my question is about TCM. We know that TCM has played a very important role as a joint recommendation by the NHC and the State Administration of TCM. The 排毒养肺 decoction is becoming very popular. So could you please elaborate on it? It's a very representative question. Indeed, it is a highly recommended prescription applied to many cases, and it has been closely watched. As far as I know, 28 provinces and the municipalities are using this prescription, the TCM prescription. It is a general prescription suitable to all the patients, and now it is expanded to the suspected cases, and it is well received. By the end of yesterday, March the 23rd, for 10 provinces outside Hubei and 66 hospital data analysis, we found that 1,265 cases confirmed who used this decoction prescription. There's no one who has ever developed into a severe symptom, and the majority of the patients have been recovered and discharged from hospitals. Also, for severe cases, none of them developed into a even critically ill case, and we have the 73% as the cure rate, and there's no damage down to the liver and other internal organs. Furthermore, based on the comprehensive analysis, publications have already been made, and you can refer to the papers for details. And also, we have the TCM masters, like Zhang Boli and Tang Zhuxuan. They have highly confirmed the TCM prescription. We are now working on the mechanism why this particular decoction prescription is helpful, and at the moment there have already been some webinars or online discussion about the usefulness or efficacy of this decoction. But as you know, for basic studies, it takes quite long time. We need animal models, and the experiments should be repeatable, so it will take some time. However, there have already been some agencies like the Marine Medical Hospital and the Bioresearch Institute of Dalian, who have already initiated the particular study project on this prescription or on this TCM decoction. They are working on the mechanisms, and some initial findings showed that all of the 26 components of this prescription are conducive to the lung meridian of the human body. This is a specific term of the TCM, and also the prescription is found to have many helpful effects, and it can curb the activity of ACE2, and it does not curb or inhibit the activity of the esophagus cell. So we can see that this may help to prevent the potential cytokine storm. At the moment, the Chinese Academy of TCM have already accomplished the quality control and the process quality control of the manufacturing process. Also, apart from the Qingfei Paidu decoction, the particles prepared from this decoction are also produced, which is more convenient to use, and it can play a more important role to help cure the patients. Okay, let's continue. On the right, on the fifth row, the third lady reporter in blue, please. Thank you. With CGTN. Now the pandemic is spreading across the world. Chinese experts are communicating with their international counterparts and sharing their experience. So what are the experiences that can be serving as a good reference for other countries? We will have Dr. Wu to answer the question. Thank you very much for your good question. Actually, this morning I took part in a video conference hosted by the Ministry of Foreign Affairs for China and 25 Latin American countries. And I've also been engaged in some other video conferences sharing Chinese experience. We had the chance to experience the COVID-19 earlier than other countries, and this has rendered us some experience in dealing with the pandemic, and such experience can serve as some reference or basis for other countries to fight against the COVID-19. We gained knowledge about the average incubation period and also the related containment measures, and we come up with the prevention and control guidelines. These guidelines have already been translated into English and shared with our international counterparts. In the fight against the COVID-19, we have also achieved some initial progress. Most importantly, we have adopted the most fundamental principle against infectious diseases. As you know, for any infectious disease, there are 3 important strategies. The first is to control the source of transmission, to curb the transmission route, and to closely control and monitor the affected population. So once you can do a good job with any of the 3 parts, you can win the success against the infectious disease. Now in China, we have adopted all of the 3 measures against the COVID-19. We have the 4 earlies, namely the early detection, early findings, early reporting, and early treatment. So we have the early detection and quarantine, and then we stop the spread of the transmission. Now Chinese people are wearing facial masks, and we keep our hands clean and also ensure good ventilation inside the houses or the rooms, and also for the protection of the susceptible population. As you can see that we extended the spring holiday break, and we advocate for safe social distancing. These are measures have been all adopted, and the core effort is to separate the transmission source from the susceptible population so that the pathogen cannot move from the source to the susceptible population. And patients who carry the virus, once they don't have the symptoms, they will not spread the virus in the general society.
This has been our fundamental principle, and in other countries, they have been contextualizing this principle based on their own institutions and contexts, and many have been referring to our experiences. Thank you. Next question, please. Journalist from the 3rd row on the right side. With the Economic Daily, in low-risk regions, some party cadres have taken the lead to remove masks when they have meetings. Will the general public follow suit when they go outside? Will this lead to resurgence risk? I'd like to again ask Professor Wu Zunyu to take the question. Thank you. That's a great question. It is based on science for the recommendation of wearing masks. You may have noticed some media reports that in European and American countries, it is not recommended to wear masks for the healthy people. The viral shedding of COVID-19 virus had such a feature that towards the end of the incubation period or pre-clinical symptom period, there was the highest amount of virus shedding. If a healthy people meets a symptomatic patient who is at the pre-symptom stage, then it carries the highest load of viral hiding, which means shedding, which means the healthy people is faced with the highest risk. Patients usually go to hospitals, so in hospitals and health institutions there is a high risk of transmission, in particular designated hospitals with COVID-19 patients. And in family with a COVID-19 patient, it is also considered as a highly risky environment. And if a symptomatic patient is already shedding virus, and this asymptomatic person is taking a lift or a transportation vehicle, then it poses risk of transmission. Also, the incubation period varies. It can be as long as 2 to 3 weeks. We have been adopting a risk-zoned approach in low-risk zones and regions. There is almost no virus load in the environment. It is safe even if you are not wearing masks, since the virus is not there. National Health Commission has issued a guideline on the scientific use of masks. For the general public, if you are staying home in the open air, you do not have to wear masks. And if the general public goes to a crowded place, better prepare a mask. If you go to a crowded place, or if you are in close distance with others, still you are recommended to wear masks. If you refer to the guidelines, you will find it has classified the general public, special staff, technicians in different places and on different occasions. There are specific recommendations for different types of people and on different occasions. You are welcome to visit the website for the specific guideline for the proper and scientific use of masks. Thank you. Next question, please. Journalist from the third row on the left side. Thank you. With the CNS, previous reports have shown that in the early stage of onset, the progression might suddenly be accelerated, and some patients may immediately suffer multi-organ failure. Can you elaborate again on cytokine storm? Will the cytokine storm add difficulty to treatment? What has been our experience in preventing cytokine storm? I'd like to ask Professor Wang Guiqiang to take the question. Yes, indeed. COVID-19 is an emerging disease. The pathogenesis is not completely known by us, but following the general pattern and rule of infectious disease, it involves the immune system's struggling with the virus. If the immune system is in good status and the virus can be well contained, there won't be further changes and the patient will be cured. But for some older folk, their immune system is poor, so there has been some back and forth of the tug of war between the immune system and the virus. There were also the hypoxia led by the lung function failures. Many patients have underlying diseases. Many of the fatality do not die from the COVID-19, rather they come from the deterioration of the underlying diseases, including co-infection and myocardial disease infection. Also, we saw some sudden changes among the younger population. The fatality rate is not big among these younger patients. So, as you've mentioned, it might be because of the cytokine storm. The immune system is too strong, because immune it needs a balance. If there has been overreaction by the immune system, it may trigger some disorder, like some immune inhibition diseases are also related to strong immune system. The immune system do not see or recognize the healthy cells. They fight both the viruses and the healthy cells. And you may also find that hepatitis B or hepatitis hepta patients have died from or have suffered further damages because of an overreactive immune system, which may lead to cytokine storm. Many of the inflammatory factors have been activated, and the interleukin has been released to cause multi-organ failure because it may damage the vascular system, which is distributed across the body and which can further trigger the multi-organ failures. Hemorrhage and the formation of thrombosis may be related to overreaction in the immune system. Therefore, clinically, we've put forward some pre-alarming signals and indicators to intervene early, because once a cytokine storm has been initiated, it's very difficult to be controlled. That's why in the 7th edition, we've emphasized that if interleukin-6 is already at a high level, patients need special attention because that is an inflammatory factor. It could also be interleukin-1 or the oncology factors, and also persistent lactate formulation, accumulation, or hypoxia may lead to lack of oxygen and blood. And also there has been some rapid progression by X-ray imaging. This is also an alert. There are also some common inflammatory factors, including C-reactive proteins and the erythrocyte sedimentation rate, the ESR factor, can also be a pre-alarming signal. For the rapid progressive accumulation of inflammatory factors, a short-term low dosage of hormone usage is recommended because for patients as such, we must inhibit the overreaction of immune reaction. However, it couldn't be too long. The dosage shouldn't be high, otherwise it may inhibit the immune system. Interleukin-6 antibody is also recommended to curb the interleukin-6 accumulation and rapid progression. Some good effects have been shown. In general, there has been major differences in the outcome in different people segments groups. There is different features for the older folks and the younger folks. We need to pay special attention to these alert indicators. China has indeed accumulated clinical experiences which are shown in our updated protocols.
Thank you. Let's continue. On the left, on the fourth row, the first gentleman. With Red Star News. Recently, in some clinics in Wuhan, there have been cases found that they don't have any epidemiological history. So, how to respond to such scenario? We will have Dr. Wu to answer the question. Thank you. It's a very sensitive question. Actually, when the issue arises, I communicated with the colleagues in the local health bureau, and he told me that they have done some investigation and findings have been released to the public. So the actual situation is not as described by the netizens. Actually, among the close contacts that we have monitored, we haven't found any new infection. This is an important question. We acknowledge that our knowledge of this COVID-19 is limited. Despite the various stringent measures that we have adopted, once we find any new situation and any emergent or new infection, we will catch up with the efforts. So we will keep a close eye on such new developments. Okay, thank you for your question. Let's continue. On the right, on the fourth row, the first reporter, please. Thank you. With China Education TV or CETV. Now, some schools restart. However, classrooms are quite packed and it's difficult to keep the 1 meter safe distance. So how to deal with such a situation? We will have Dr. Wu to answer the question. Thank you for your question. This question is related with the mask wearing in low-risk areas. Actually, in low-risk areas, we don't think there's a virus spreading in the areas. So for schools in the low-risk areas, once they restart, it is believed that the teachers and the students are exposed to very limited and very low risk of virus infection. And it is also necessary to continue the protection measures. The most important thing is that we should have the daily monitoring of the health conditions, the body temperature, and the symptoms. Once a symptom is identified, it should be immediately reported to the local health authority and to be treated appropriately. There are a lot of questions, but due to the time constraint, we can only allow 2 more questions. Please, on the left, on the 4th row, the 3rd reporter in pink, please. Thank you. With China.cn. WHO emphasizes that the young generation is also faced with the exposure risk. So how about their disease development? Is it different from the elderly patients? We will have Dr. Wang to answer the question. Thank you for your question. Indeed, for the COVID-19, we do find many differences between the young population and the elder population. For the young population, the young group, it is of a lower prevalence rate. At the moment, we haven't got the latest data. The previous CDC data indicated that about 8% of the prevalence, while the elder population group has a higher prevalence. And also, previously, we only had very limited number of cases of the young population, but the elder population group with underlying conditions have fairly high prevalence. That's why we are making very active measures to identify and to cure the cases. But this does not mean that we neglect the young population. Just as I have mentioned, there might be sudden disease progression of the young population group. And now the current consensus is that the elder population group is high risk, but we should never neglect the young population group, as they are also subject to the COVID-19. Let's continue on the right, on the 5th row. Thank you. With House News. we noticed that for COVID-19 patients, especially the severe cases, many of them have comorbidities. So how to adopt a balanced approach to treat these patients? We will have Dr. Wang to answer the question. Yes, indeed, it's a very technical question. As we have mentioned, for COVID-19 infection, the elder population and the population group with the comorbidities have a higher fatal rate, and for people who are still hospitalized, they are mainly the elder population group and the people with underlying conditions. So we are treating their underlying conditions and adopt a comprehensive approach to treat their diseases or symptoms. Actually, many patients passed away because of the underlying conditions or the co-infection. So in Wuhan and other parts of the country, we take a very active approach to treat the underlying conditions. For the pulmonary system, we have the oxygen therapy. Previously, we mentioned that there's a dedicated intubation team. This team is very important because the underlying conditions can be relieved by intubation. And also, we actively support the functioning of the important organs like the liver, the heart, and etc. We take a very active approach to treat these symptoms. So in Wuhan, we have established the multidisciplinary treatment team, including experts from cardiology, from the kidney department, and etc. For a patient with underlying conditions, it is not just about the oxygen therapy, it is more about the whole systemic treatment. And we found such approach very effective. Now the case fatality rate has been greatly reduced. The remaining patients are the severe cases with underlying conditions, but the case fatality rate has been kept at a low level. So this has become a very popular or well-received approach to treat the patients with underlying conditions. Okay, in today's press conference, we have experts sharing with us knowledge which are very technical as they are about the treatment. And for tomorrow's press conference, we will talk about the adoption of information technology to facilitate the pandemic containment. And we will have experts from the Ministry of Information Technology to take questions. That's all for today's press conference. Thank you all.